YouTube channel Dental Dictionary. Today we are going to talk about the topic that is introduction of endodontics, or how can we introduce the endodontics. This video is all about the general introduction of endodontics. So we are going to start our video with the topic that is etymology of endodontics. Endodontics is made up of two Greek words. First word is endo, that stands for inside, and the second word is odon, that stands for tooth. So on the whole we can say that endodontics is the branch of dentistry that is associated or that deals with the inside of the tooth. Inside of the tooth is the pulp. So we can say that endodontics deals with the pulp. Going toward the definition, or how can we define endodontics? The definition of endodontics is the branch of clinical dentistry associated with prevention, diagnosis, and treatment of pathosis of dental pulp and their sequelae. As by etymology, we are clear that endodontics is related to the pulp. So, the scope of endodontics relies in the prevention, diagnosis, and treatment of pathosis of dental pulp and their sequelae. And by definition, we can also say that endodontics is a branch of clinical dentistry. Dentistry has two main branches. First is the clinical dentistry branches, and the second is non-clinical dentistry branches. So, as endodontics is involved in clinical practice at very much level, so we can say that endodontics is branch of clinical dentistry. Going towards the next topic of our video about introduction of endodontics, that is main aim of endodontic therapy. That why we do or why dentists do endodontic therapy, or why someone prefers endodontic therapy. So there are three main aims of endodontic therapy. The first aim is to maintain the vitality of the pulp. As the pulp is very much important for the tooth and its blood supply and all the things, so the main aim of endodontic therapy is to maintain the vitality of pulp. The second aim of the endodontic therapy is to preserve and restore the tooth with damaged and necrotic pulp. When the pulp is damaged and necrosed and cannot be treated to its health, so there comes the second aim of endodontic therapy, that is to preserve and restore the tooth with damaged and necrotic pulp. So going to the third aim of endodontic therapy is to preserve and restore the tooth which have failed the previous endodontic therapy. So as we said, there are three aims of endodontic therapy, and all the three aims of endodontic therapy works at three levels of pulp. When the pulp is minimally affected or infected, the first aim of endodontic therapy is to maintain vitality of pulp. But when it is infected to the extent that it cannot be restored, then the aim of endodontic therapy is to preserve and restore the tooth with damaged and necrotic pulp. And after that, if the endodontic therapy has failed, there comes the third aim of endodontic therapy, that is preserve and restore the tooth which have failed to previous endodontic therapy. So these were the three main aims of endodontic therapy. Going toward the next topic of our video, that was the introduction of endodontics, that is primary goal of endodontic therapy, that why we prefer endodontic therapy, or what should be the goal of endodontic therapy. Whenever we do something or we want to reach something, we have a goal in mind. So the goal of endodontic therapy is to create an environment within the root canal system which allows the healing and continued maintenance of health and periodocular tissue. And this can be done by endodontic therapy by removing the necrotic pulp, or by treating the pulp to the healthy state, so that there is the minimum infection or zero infection at the periodocular tissue, and so that periodocular tissue can heal to and continued maintenance of health of periodical tissue it can be possible. So that was the primary goal of endodontic therapy. So next, endodontics as an art or science. Sometimes people are confused that endodontics is included in art or science because endodontics is also an art of the dentist or endodontist and also a science because there are many scientific calculation and informations and theories behind endodontic therapy. So endodontics has been defined as art as well as science of clinical dentistry because in spite of all the factual scientific foundation on which endodontics is based to provide an ideal endodontic treatment is an art in itself. So we can say that endodontic is art as well as science of clinical dentistry. Thanks so much for watching our video. Don't forget to like, share, subscribe and comment.